Hi, my name is Craig Anderton with Medicare Rocket, and today we're going to talk about the top 5 biggest mistakes that people make when they turn 65 or get into Medicare. Stay tuned. Mistake number 1, that is waiting too long to get started. So let's say that your birthday is December 10th, and that's when you turn 65. So what the Medicare rules say is that you can actually sign up for Medicare 3 months prior to your birth date month. So that means that if you count back 3 months, that's November, October, and September. September 1 is the very first day that you can sign up for Medicare. I would highly encourage you to do that. You do have actually the 3 months prior. You have your birth month and then 3 months after your birth month to sign up for Medicare. But I tell folks, and I tell all my clients, don't wait, don't procrastinate, because this is one of the most important things to not procrastinate on. You want to be able to get your Medicare card in your hand as soon as possible so that you're prepared and you can read through the information. Once you have applied for Medicare, then what you need to do is to decide on a Medicare supplement. Say a Medicare supplement or a Medicare Advantage plan, but you need to make sure that the gap that Medicare does not cover is covered. So Medicare basically covers 80%, and you need to find something else at that time. So both of them you do within that first month that it's available to you. So again, in the December example, we count back 3 months, November, October, and September. So September, you apply for your Medicare, and then you also, after you do that, you apply for your Medicare supplement or your Medicare Advantage plan. You want to make sure that you do that in that first month so that you have your cards in your hand, because it takes anywhere, and depending on if you're in a busy season like the Medicare open enrollment, it could take a month and a half, or it could take up to 2 months to get your cards. Normally it takes around 3 to 4 weeks, but it could take longer than that, especially during the busy months. So you absolutely want to get those in your hands, and the information that they send you, you want to be able to read through and get familiar and ask questions to your agent, like myself, and be able to get familiar with how things are going to work once that December 1st or the first day of whatever your birth month is. That's when Medicare will start. That's when your benefits will start with the supplement plan or the Medicare Advantage plan. The second biggest mistake that people make is they miss the window to get their Part B. Now, previously in the first mistake, I mentioned that people, they wait too long, and they have a certain amount of time to get that Medicare. So again, you have 3 months prior to your birth month, you have your birth month, and then 3 months after your birth month. And the most important thing is that you don't pass that window. Once you pass that window, then it's delayed. But more important than that is that you get a penalty from the government. The government will dole out a penalty for you if you pass that time frame, and that penalty will follow you basically for the rest of your life, unless there's a special circumstance, basically of low income status. Other than that, that penalty will follow you for the rest of your life, and you don't want to pay more than you already have to pay. And so don't pass that Part B time frame. Again, they're 6 months, but again, I tell all my clients, get it in the first month that it's available to you. And that way that you don't have to worry about it, especially those, I mentioned the December birthday, those who have December birthdays like myself, actually, they, and there's Christmas and the holidays, you want to get that thing done and out of the way. Another thing that you want to be really aware of is that you have to get a Part D drug plan. So don't pass up the time frame for your Part B, but also your Part D is in drug plan or a prescription drug plan. Because if you do pass that one up as well, you will receive a penalty from the government that will follow you for the rest of your life. So again, The time frame for Part B is those 3 months before, and then also your birth month, and then the 3 months after. And that's the same thing with the Part D drug plan. You want to make sure that you have one. If you're someone who has very few prescriptions, you still want to get a plan that will cover you, and that will keep you away from that fee, or the penalty that the Medicare gives for not having a drug plan. So let's say that you pass up the window of time that you get that, and then later on, a couple of months or a couple of years, you want to get a prescription drug plan to help cover costs. You will incur a penalty from the government that will follow you for the rest of your life. So I just recommend to most of my clients to make the choice to get a prescription drug plan. And there's many prescription drug plans out there that are inexpensive. So my recommendation is that get one at the same time that you get your Medicare supplement or your Medicare Advantage plan. Another big mistake is that people or clients, they trust their family or friends or relatives, their brother, their aunt, whoever, their spouse, to get the same plan that they have, or they trust the advice of them, and that can be good, but at the same time, every plan is customized for an individual. I mean, it's like going to the doctor. Not everybody has the same symptoms for everything. Everybody feels differently. Everybody has things that are different, and the doctor is going to analyze you based on how you feel. And that's the exact same thing that happens with Medicare and Medicare supplement. So if you get a Medicare supplement or a Medicare Advantage plan, you will need to talk to an experienced agent, and especially an independent agent who knows about all the plans in your area, who shops the plans every year like we do at Medicare Rocket. And when I get a client in my office or I'm talking to them on the phone, I go over questions. I say, okay, how's your health? And your plan, previous plan, what do you have? What do you like? Think questions like that, and then they customize that plan. Now, an agent can go over many different plans in the area based on what you want, but the most important thing is that the plan kind of needs to be customized to you. Your experience in life and your health needs to go towards a specific plan and not the same plan as your relatives or your friends. So that's one of the big mistakes that people make. Another huge mistake that people make is they think that the most expensive plan is the best plan to buy. And that is not always the case. In fact, time and time again, I have clients in my office that are paying lots of money for a retirement plan that actually doesn't get the best benefits. So I cut people's rates down, where they're paying almost half of what they were before, and they're getting more coverage. And so don't fall under the assumption that the most expensive plan out there is going to cover you the best and have the most amount of benefits for you. So big mistake a lot of people make, and it just costs them, and they can't recover that money, obviously. So that's what we do here, is we help make sure that our clients have the least expensive plan for their needs, and then we shop the market every single year. The final and biggest mistake that people make is that they get the wrong agent. And there's a couple of different kinds of agents, but the one to really avoid is the captive agent. Captive means that they represent just one company, and they have a couple of plans possibly within that company, but it's just one company. So let's say, they just work for one company. I'm an independent agent. We here at Medicare Rocket are independent agents, and what that means is that we offer all of the plans that are on the market and represent all the companies that are within the market. That means that we can shop for the best plan for you. A captive agent they can't shop anywhere else. They can only stay within that company, and that's it. And let's say that something happens with that company later on down the road, they're going to, let's say you get a Medicare Advantage plan and things go away that you wanted, but that captive agent is going to do all they can to keep you within that company, even though it might not be for you anymore. But so the most important thing is that you want to talk to an independent agent like myself to be able to help you decide which one's best for you. And if something happens to where it loses coverage of something that you need, you can move to a different company or different provider. And that's what we do. We help folks from year to year. If their prescriptions increase, then we shop for another company during open enrollment. And so that's, again, one of the biggest mistakes that people make. The biggest mistake is that they have the wrong agent. And you want to have an agent that covers the gamut of companies out there that can shop for you and to make sure that you're getting the best deal from year to year. And so what I, again, recommend that you do is find an independent agent. We'd love to talk with you. Again, my name is Craig Anderton, and I'm with Medicare Rocket. You can call us at the toll-free number anytime, and love to help you through and answer your questions. And let's say that you're already in a plan. That's fine. And you've got questions, give us a call. But we'd love to help you out and help you through the process of finding the best price plan, but also the plan that fits you. And make sure that fits you each year and that you are covered from year to year and you have somebody to call to. So I'd love to help you out. Give us a call at any time at our 800 number, and I will talk to you soon. Have a great day.